Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, COVID-19, The Road Ahead, is presented by Dr. Stefan Catalya. Dr. Catalya is an internal medicine specialist with a special focus on infectious diseases. Dr. Catalya received his medical degree from St. George's University School of Medicine, and in August 2020, he joined the Washington Township Medical Foundation. Without further ado, please welcome Dr. Stefan Catalya.
All right, and again, thank you for that intro. My name is Dr. Stefan Catalya. I'm one of the infectious disease doctors here at the Washington Hospital Healthcare System. And thank you all for tuning in today. Our talk is called COVID-19, The Road Ahead. Basically, we've all been through a lot for this last year plus now, but I just want to talk about how we're doing now and what potentially could be ahead in the future for us. So just a quick rundown of the topics we'll be talking about today. First, how are we doing here in Alameda County and California, and how does that compare to the rest of the world and also the rest of the country? We'll be talking about the different COVID-19 vaccines, focusing mainly on the 3 that are currently available to the general public. Risk factors for different age groups, the symptoms of COVID, how to protect yourself from getting COVID and preventing others from getting COVID. And then we'll finish off with the different available treatments for COVID-19, both inside the hospital and outside the hospital. So first, how is Alameda County doing? All this information, it's courtesy of the Alameda County Public Health website. Information is up to date as of last Friday. And as you can see in the top left graph there in our total daily cases, the number of cases we've had each day has come down substantially, thankfully. We obviously, around this time last year, there weren't that many cases. Then in the middle to late summer, we did see our first initial surge, which then did quiet down as we got into the fall. But unfortunately, as after the election, and then as we got closer to the holidays like Thanksgiving, Christmas, and New Year's, we saw a huge surge in COVID cases, both inside the hospital and outside the hospital, as you can see in that graph there on the top right corner. But fortunately, as things went back into lockdown while getting people vaccinated, starting in December, and as we've gone forward since, our case numbers fortunately have improved. As you can see there, not just in terms of the number of tests, but also in the percent positive, as we have as of last week, we're at the 1.4% 7-day positive tests. And also, as you can see in the lower right-hand corner, I added there a graph based on the number of vaccines that the county has been able to give out on a daily basis. And fortunately, the number of vaccines has gone up since we first started the vaccination process, except for within the last couple of weeks, unfortunately. But overall, things have gotten a lot better for us, especially compared to how the holidays were in the end of 2020. In terms of how the state of California is doing, these tables are courtesy of the California Public Health website. And it mirrors more or less what Alameda County has been doing. California did see its surge back in the second half of the summer, which did quiet down as we got to the fall. And then again, as we got closer to the end of the year, around the holidays, we did see that huge jump that was very widely talked about in the news. And then fortunately, again, as things did go back into our most recent lockdown with the rollout of the vaccines, the case numbers have come down significantly to the point where obviously we're talking about reopening things up again. That also is mirrored in our death tally as well there on the right-hand side. And in terms of how that compares to the rest of the country, This table or this map is courtesy of the Centers for Disease Control, which tracks COVID cases all throughout the entire country. Fortunately, you can see California there in the west. Our case rate adjusted per 100,000 people over the past week. It's actually gotten a lot better, and it's better than in a lot of the other states here in the U.S., especially in the southern part of the U.S., from Texas going towards the Gulf Coast states, which unfortunately have had relaxed mask mandate issues most recently in the last couple of weeks. And then also in the northeastern states, including New York and New Jersey, which have a very dense population and also have had a lot of issues with the weather over the last few weeks now. And then in terms of how the U.S. is doing as a country compared to the rest of the world, you can see that table on the left there. This data is courtesy of the Johns Hopkins University, which has been tracking COVID cases globally. In the end of 2020, the U.S. had a huge surge in COVID cases, far more so than the rest of the world. But fortunately, over the last couple of months, as you can see right there, where we had our peak in January of 2021 with the vaccine rollout, the number of cases in the United States has come down significantly to the point where the U.S. is not leading the world in terms of new COVID cases. That title most recently goes to Brazil, as they have had issues obviously with the vaccines and with the different variants, which we'll talk about later on. And then in terms of the deaths per 100,000, the U.S. unfortunately is still still very high up there in deaths per 100,000 people, but other countries like Italy and Czechia have had more deaths per 100,000 over the last couple of months. Compared to the United States. Italy, of course, has had significant issues with the variants. Again, that's something we'll be talking about later on in this talk. But obviously, something that's been talked about a lot in the news lately in terms of how we can help end the COVID pandemic is why vaccinate. So vaccines, just talking about them in general first, a vaccine may help keep one from getting seriously ill if they get infected. Vaccination can also protect those around you, especially those who are increased risk for severe illness. Experts, scientists, doctors continue to conduct more studies about the effect of vaccination on severity of illness, as well as its ability to keep people, more studies about the effect of vaccination on severity of illness, as well as its ability to keep people from spreading the virus that causes COVID. Getting COVID may offer some natural protection that was talked about last summer with antibodies, but how long that lasts is largely unknown, and the risk of severe illness and death from COVID far outweighs any benefits of natural immunity. And then also, of course, getting the COVID-19 vaccine will help protect everyone by creating an antibody response without having to experience the actual sickness, including, God forbid, getting hospitalized, getting hooked up to a ventilator for days or weeks on end. We all know that wearing masks and social distancing helps reduce exposure to the virus and its spread, but unfortunately, these measures are not enough by themselves. The combination of getting the COVID vaccine, wearing masks, practicing social distancing to protect yourself and others offers the best protection, and stopping a pandemic requires using all the tools we have available. So to talk about vaccines and why they do work, there have been numerous stories about vaccines in the past and their ability to provide protection and to help either eliminate or eradicate diseases. The smallpox vaccine was first described by Edward Jenner in 1798, and that led ultimately to the eradication of naturally occurring smallpox in 1977. The first polio vaccine was available in the US in 1955, and thanks to the widespread use of the polio vaccine, the US has been polio-free since 1979. That picture there, it's a picture of Elvis Presley when he was on the Ed Sullivan Show in the late 50s, getting vaccinated. And that image and his appearance on the show was widely credited at the time with promoting vaccine acceptance and showing that it was, safe to do and it was the right thing to do. And before the U.S. mumps vaccination program started in 1967, mumps was considered a universal disease of childhood. But since the pre-vaccine era, there has been a more than 99% decrease in mumps cases here in the U.S. But now talking about the different COVID vaccines, currently there are 3 vaccines in circulation here in the United States to stop the spread of COVID. The first 2 are the Moderna vaccine and the Pfizer-BioNTech vaccine. These are the ones that you heard about in November and December. They were released to much fanfare at the time. These are messenger RNA-based vaccines that require 2 shots. I'll get into a little bit more about that later on. And the other one, the third one rather, that's available right now is the Johnson & Johnson vaccine. That is a DNA-based vaccine which requires only 1 shot. There are 2 other vaccines that have been in the news recently and could be approved here in the United States in the coming weeks or months. The first one is the AstraZeneca vaccine. That is another DNA-based vaccine that requires 2 shots. And then there's another vaccine called Novavax, which utilizes a spike protein, and that is going to be, or potentially could be approved in the coming weeks to months, but is not available right now. So first, in terms of talking about these vaccines, it's a good idea to understand how they actually work. So we'll start off with the Pfizer and Moderna vaccines. They teach our cells to make a protein, or even just a piece of a protein that triggers an immune response inside our bodies. These COVID vaccines give instructions for our cells to make a harmless piece of what is known as the spike protein. So if you think about, I included in here also in our talk, that's an image of the coronavirus. We've seen it all by now in the news, on the internet, in social media. It's basically that sphere with the little protrusions that come out of the virus itself. And those little protrusions that come out are called spike proteins. These are found on the surface of the virus that causes COVID-19. So messenger RNA is injected into the person's arm. Keeping in mind that, by the way, this is called messenger RNA, not DNA, not the stuff that you hear about in paternity tests or in crime shows or in courtroom proceedings, but that's DNA. This is something called RNA. So basically, messenger RNA gets injected into the person's arm. Muscle cells then use that messenger RNA to make the spike protein piece. Muscles then dispose of the messenger RNA in your arm so that whatever was injected into you, at that point, it's gone, and they use the spike protein to piece in your immune system, and they display that to your immune system. Our immune system then recognizes the protein doesn't belong there, and it starts making antibodies. So these antibodies will remove the spike protein on its own, but fortunately for us, these antibodies do decide to stay in our system. So God forbid COVID-19 ever comes into contact with you or us, these antibodies can stop COVID-19 from causing a major illness. Talking then about how the other COVID vaccines work, AstraZeneca and Johnson & Johnson don't use messenger RNA, they use DNA. Otherwise, your body does basically the same thing. It uses that genetic material to make the spike protein, and then it forms, and then your immune system winds up forming antibodies to that spike protein, giving you protection against COVID-19. The other thing to keep in mind is that the Johnson & Johnson vaccine is 1 dose only, whereas all the other COVID vaccines require 2 doses. Of note, Novavax, which is not available yet here in the US, but could be in the future, avoids genetic material altogether. What that vaccine does, it just injects the spike protein directly into your arm, and then your immune system forms antibodies to the spike protein, giving you protection against COVID. So in terms of how well do they work? So obviously there's a lot of different vaccines out there, so I'm going to try and stay focused on the 3 that are currently available here in the US. So starting with the Pfizer vaccine efficacy in preventing confirmed COVID occurring at least 7 days after the second dose was 95%. And that was in a study of 38,000 participants. They found that out of those 38,000 participants, there were only 8 people who got the vaccine that wound up getting the actual disease itself, whereas there were 162 people who wound up getting infected with COVID who got the placebo. Basically, the people in that group did not get the vaccine. They just got like a small amount of water injected into their arm, essentially. Moderna vaccine efficacy was also very good in preventing confirmed COVID-19 occurring at least 14 days after the second dose. And they've had an efficacy or an effectiveness of 94.5%. And that was in a study that included 30,000 participants. In their study, they found 5 people who had gotten their vaccine wound up developing COVID out of, and then 90 were in the placebo group. Again, that was out of 30,000 people. The Johnson & Johnson vaccine, its effectiveness has been talked about in the news a lot recently, as you probably have heard. And their vaccine efficacy was determined to be 66.9% when considering cases occurring at least 2 weeks after the one shot. In the vaccine and placebo groups, respectively, there were 116 and COVID cases in those who got the vaccine, and 348 cases in those that occurred in the placebo arm at least 2 weeks after the vaccine. But the one thing to keep in mind is that the Johnson & Johnson vaccine was tested in areas that were known to have the South African variant, whereas the Pfizer and Moderna vaccines were not tested in areas known to have the South African variant. So it is possible that the Johnson & Johnson vaccine efficacy gets brought down a little bit because of the presence of the South African variant, and that's something we'll be talking about a little bit later on. In terms of the side effects, the side effects were pretty similar across all 3 different vaccines. The most common one, really, out of all 3 was called injection site reactions. It's basically pain in your arm, right where the needle goes in. So that was the most common one. For Pfizer, it was 84%, whereas in Moderna, it was 91%, and in Johnson & Johnson, it was less than 50%. Other side effects for Pfizer included fatigue, headache, muscle pain, chills, joint pain, and fevers. For Pfizer, severe reactions occurred in less than 5% of all participants, and they were more likely to occur after the second dose. They were less likely to occur in people who are in advanced age, specifically those 55 and up, compared to younger participants. And all of those people who had side effects that were considered to be, quote, transient and manageable. That is, they resolved within 1 to 2 days after getting the vaccine. And they also were manageable by over-the-counter medications to help deal with like muscle pain or fevers, like with basically taking Tylenol or other over-the-counter medications. For the Moderna vaccine, again, the most common side effect was pain right where the needle goes in, followed up by fatigue, headache, muscle pain, joint pain, and chills, similar to the Pfizer vaccine. Severe reactions there occurred in about 0.2 to 9.7% of participants, more after the second dose, less though in those older than 65 compared to younger participants. And again, similar to the Pfizer vaccine, most adverse events were mild to moderate in severity. For the Johnson & Johnson vaccine, again, injection site pain was the most common one, but of note, this occurred in less than 50% of the people who participated in their trials. But again, that was followed, the other side effects included headache, fatigue. Johnson & Johnson described it as myalgia, but myalgia basically is the same thing as muscle pain, when you think, just to sort of clear that up. And again, all of these were considered mild and moderate, and similar to Pfizer and Moderna, their vaccines, or the Johnson & Johnson vaccine, had side effects less common in those age 60 and up, and most, again, resolved within 1 to 2 days post-vaccination. Obviously, with the vaccine rollout and how quickly these got developed and approved and now are being distributed, there's been a lot of questions. So first question, the one that gets asked a lot is, are the vaccines safe? And the answer is yes. All the COVID-19 vaccines being used here have gone through rigorous studies to ensure they are as safe as possible. This includes meeting rigorous safety criteria set by both the FDA and the CDC, not criteria that were created necessarily by the vaccine makers themselves, but again, it was criteria set by the FDA and the CDC. Other questions, if a person got COVID, do they need to get the vaccine? And the answer is yes. Due to risks of COVID-19 and reinfection, the vaccine is still needed. That being said, when you can get the vaccine if you got COVID needs to be cleared up a little bit, because if a person got COVID and their treatments included getting monoclonal antibodies or convalescent plasma, you need to wait 90 days before you can get the COVID vaccine. So if you're not sure how you were treated or what medications you got, the best thing to do is talk to your doctor to figure out if you have to wait the 90 days. The other questions, can I get an allergic reaction with the COVID vaccine? So serious problems from vaccination can happen, but are incredibly rare, similar to other vaccines that have been given out for decades now. Can I get the COVID vaccine at the same time as another vaccine? So ideally, we recommend waiting at least 14 days before getting any other vaccine. That includes the flu shot or the shingles shot if you get your COVID-19 vaccine first. And if you got another vaccine first, we recommend you wait at least 14 days before getting your COVID vaccine. The idea there is to avoid overwhelming your immune system with, by having to create antibodies to two different diseases. That way, and also to avoid the formation of, avoid like a sort of a cross reaction is what I meant to say with the different vaccines. And also to give your body time to recover from each shot. Otherwise, if the vaccine is inadvertently given within 2 weeks of another vaccine, there's no need to restart the COVID vaccine series. You just keep going. You just finish the series when the timeline is appropriate. If I am vaccinated, can I still get COVID or spread it to other people? And the answer is yes. So vaccine trials did show that a very small percent of people still got COVID but had less severe symptoms. And yes, you could have zero symptoms and still spread the virus, as we've all seen so far. Other questions, can I get the vaccine while pregnant or breastfeeding? So pregnant people in a group recommended to receive the COVID-19 vaccine may choose to be vaccinated. We're talking about, healthcare workers, essential workers, etc. But the best thing to do would be talk to your doctor if you have any other concerns before getting the vaccine, as it's really an individual decision for each person. That being said, there's also no data available on the safety of COVID-19 vaccines in lactating women or on the effects of messenger RNA vaccines, that is the Pfizer and Moderna vaccines, on breastfed infants or on milk production and excretion. Messenger RNA vaccines like Pfizer and Moderna are not thought to be a risk to breastfeeding infants, however. And then another term that's been thrown about a lot in the news lately is the phrase fully vaccinated. And just to clarify, what exactly does that mean? So as per the CDC definition, it's 2 weeks from when you got the last dose of the vaccine. So Pfizer and Moderna are 2 vaccines. So it's 2 weeks from when you got the last dose, or when you got the second dose of the Pfizer and Moderna vaccines. So let's say today is March 16. So if you got your second dose today, you would be considered, quote, fully vaccinated 2 weeks from now. And for Johnson & Johnson vaccine, since it's only one shot, if you got the Johnson & Johnson vaccine today, you would be considered fully vaccinated, 2 weeks from today. That's basically the amount of time needed for the vaccine to take full effect. More questions. Once I get the vaccine, do I still need to wear a mask, socially distance, and wash my hands? Yes. The pandemic will continue until herd immunity is reached. You can still spread COVID even if you are vaccinated and have no symptoms. That being said, the CDC did list guidelines last week for what people who are fully vaccinated can do. So first, if you are fully vaccinated, you can gather indoors with other people who are also fully vaccinated without mask wearing. You can also gather indoors with unvaccinated people only from one other household. That is, as an example, visiting with relatives, but all of your relatives live together. You can meet up with them without masks unless any of those people or anyone they live with has an increased risk for severe illness from COVID. If you've been around someone who has COVID, you do not need to stay away from others or get tested unless you have symptoms if you're fully vaccinated. The one caveat to that, though, is if you are fully vaccinated but you live in a group setting, like live or work in a group setting, like a correctional facility or a detention facility or a group home, and you've been around someone who has COVID, the CDC still recommends that you stay away from others for 14 days and get tested, even if you don't have symptoms, because obviously those types of facilities have been shown to be very high risk for spreading COVID. So in terms of where we can get the vaccine, there's different things to consider. Alameda County website has a resident vaccine notification form. So if you go to that website right there, and then you click on Get Notified when it's your turn, there's a form you can fill out. The other option would be to visit myturn.ca.gov, and that is the state of California website, which also will tell you where you can get the vaccine. The Alameda County website also lists CVS and Rite Aid as offering COVID-19 vaccines. That being said, obviously, vaccine tourism has become quite a big thing over the last couple of months. So if you choose to go to a different county, like say Santa Clara County or Contra Costa County, it's best to check with your provider or the provider there or the pharmacy there and making an appointment just to make sure that you, as not a resident of those counties, would still actually be able to get the vaccine. And then now moving to something we've kind of hinted at already, that's already been talked about in the news a lot too, are the different mutations. So, and also known as variants. So viruses constantly change through mutation. New variants of a virus are expected to occur over time. Viruses unfortunately just mutate a lot. It's something that they do. So since the pandemic began, there have been several different COVID-19 mutations discovered since the pandemic began. The one that's been talked about a lot is the B.1.1.7, known as the UK variant, which, as you've seen in the news recently, is the variant that's most likely to become the most common form of the COVID virus in the coming weeks to months. But of course, there's also been the South African variant, which is raising concerns about the possibility of mutations, as well, and resistance to the different vaccines. The P1, which is known as the Brazilian variant, the Cal20C, which is known as the Southern California variant, and the B.1.526, which is found in New York City and in the state of New York. Scientists continue to study these mutants while looking for new variants throughout the world. Vaccines that are currently distributed now still provide protection against these variants. That being said, both Pfizer and Moderna are looking at the new mutations, the new variants, on a regular basis, and it is possible that in the future you may need a booster shot to protect yourself against these new variants. And the best way to think about that is it's similar to how you're supposed to get a new flu shot each year, because the flu virus also has the ability to mutate significantly and frequently. So talking about the risk factors now, these are things that obviously have been talked about a lot in the media over the past year, but something I just want to touch on here really quickly. First thing, the first risk factor is increasing age. Anyone can be infected, but middle-aged and older people are most commonly affected and are most likely to have, or more likely to have severe disease. And then other comorbidities associated with severe illness and mortality include cardiovascular disease. That's basically anyone who has a problem with their heart or problem with the circulation. So you're thinking about like anyone who has like a blood flow problem or like a heart problem, if you've ever had a heart attack or heart failure, you're basically, you're probably going to be in this category. And then also another significant risk factor is diabetes, followed by hypertension, chronic lung disease. We're talking about people who have asthma, people who have chronic obstructive pulmonary disease, also known as emphysema, people who have cancer, people who have chronic kidney disease, and people who are also on dialysis, people who are obese, and also smokers. And as a quick side note, something that we've talked about a lot over the last few years to decades now, please, if you do smoke, try to quit. It's possible, you can do it. Please, it'll help make your life a lot better in a lot of different ways. Otherwise, other risk factors include socioeconomic background and gender. So Black, Hispanic, South Asian people comprise a disproportionately high number of infections and deaths. Men account for a disproportionately high number of critical cases and death also. And then in terms of like the symptoms you should be looking for, obviously the most common one is cough, which occurs in about half of all cases, followed up by fever. And I wrote there subjective or above 100.4 degrees Fahrenheit. Subjective is basically like a person who really feels warm, like not just the room is hot, but like you feel like you're really like hot or you're burning up, or anyone who like checks their temperature and has a temperature above 100.4. It's followed up by myalgias, like muscle aches, headache, dyspnea, which is the medical term for shortness of breath or trouble breathing, and then followed up by sore throat, and then also when you get down to like less frequent symptoms, that's you think about like stomach symptoms like diarrhea, nausea, vomiting, abdominal pain, and then something that does get talked about in the news is that loss of smell or taste, as well as rhinorrhea, which is basically a runny nose. Those three and abdominal pain occur in less than 10% of all cases. That being said, there is also, the recovery period because, we have had a lot of cases, obviously, and, the road to recovery is not going to be the same for everybody. The time to symptom resolution, as we've seen, depends upon premorbid risk factors, that is, the number of medical issues a person had before they got infected with COVID, severity of the acute illness, and symptoms experienced. So symptoms like fevers, chills, olfactory and gustatory symptoms, so like loss of taste, loss of smell, typically go away within about 2 to 4 weeks. That being said, other symptoms like fatigue, shortness of breath, tightness in your chest, cognitive defects, and psychological effects, unfortunately, can last a lot longer they can last for months. To this end, about maybe a month to 2 months ago, Dr. Fauci coined the term post-acute sequelae of SARS-CoV-2 infection, abbreviated as PASC. And this is basically the syndrome for people who have had lingering symptoms, which include fatigue, gastrointestinal problems, like the sort of brain fog, quote unquote, basically inability to focus, depression, anxiety, sleep difficulties, and as well as impaired lung capacity. Unfortunately, right now, research is ongoing into all these different effects, but we don't quite yet have a magic pill that will treat people who suffer from PASC. As of right now, really the main thing that we do is give supportive care, and we just treat the symptoms basically as they pop up. That being said, how to protect yourself from getting and preventing others from getting COVID-19? So there's a lot of things that can be done here. First, when the vaccine becomes available to you and your doctor says it is okay, make sure you get the COVID-19 vaccine. Continue to practice effective hand hygiene. That is, making sure you use hand sanitizer or washing your hands with soap and water for 20 seconds. Make sure you wear a mask when you go outside your house, even if it's just to throw the trash, check the mail, or walking your dog. You never know when you're going to wind up bumping into a neighbor when you walk through the hallway of your apartment building who may have COVID, or if you go outside and you wind up talking to a neighbor and then that person isn't wearing a mask and you wind up getting too close to them. So basically, please remember to wear a mask when you go outside your home. To that end, the CDC actually now recommends double masking if you can, like what I'm doing here and what I'm doing in the photo, if you can. That's basically a surgical mask covered by a cloth mask. The idea there is that the cloth mask, which is on the outside, helps to stop the droplets, and it also keeps the inside mask, the surgical mask, it helps it keep the inside mask free of dirt and also keeps it dry. And then the surgical mask on the inside also has a filter which helps to catch even more droplets. And then similarly, it helps to prevent the spread of droplets to others because you get that extra layer. And then also, of course, also something we've talked about a lot over the last year now, make sure you practice social distancing and try to avoid large crowds as much as possible. That being said, we're now talking about the different treatments available for COVID-19. This obviously is a field that has evolved quite significantly over the past year. Here at Washington Hospital Healthcare System, we have different treatments as an outpatient. We have one option called bamlanivimab, which can be given with another drug, or another combination called caricivimab and imdivimab. I know it's a mouthful, but those are the different names of the drugs. The second combination, the caricivimab and imdivimab, is actually more commonly known as Regeneron. You may remember back in September, October of last year when former President Trump got infected with COVID, he was taken to Walter Reed and underwent numerous treatments, and that one was one of the treatments that he received. Otherwise, this is mainly for mild to moderate COVID patients who are at high risk for progressing to what we call like a severe disease or needing to be hospitalized. Here in Washington Hospital Healthcare System, we look for like how long a person's been sick. Typically, we would give this medication if they've had symptoms for no more than 10 days, if they do not need to be admitted to the hospital, if they're breathing, if their oxygen saturation is 94% or more in room air. So to be clear, that's basically like when you go to a doctor's office and they put that little thing at the end of your finger and they check the amount of oxygen. That's to check the amount of oxygen. So if you're 94% or higher, then you would qualify for this treatment. Weight also has to be greater than 40 kilos as per the drug manufacturers. For those of you who didn't do the conversion, it's about 88 pounds, it's about 88 to 89 pounds. And also another requirement is not being on supplemental oxygen. These medications of note are not approved for use in patients who are hospitalized due to COVID. And then I included at the bottom there a table of the risk factors, the risk criteria that we consider when we decide whether or not a patient would benefit from these medications. It's basically stuff we've more or less talked about before. And in terms of other available treatments, if a person, God forbid, has to be hospitalized, there are different treatments we can give inside Washington Hospital. The first one that we usually give is a medication called remdesivir, and that's a treatment that takes 5 days to give. We also can give a drug called dexamethasone. This is a steroid. It's not the same type of steroid that people think of when they, that bodybuilders use. This is a type of steroid that helps decrease inflammation in a person's airway, so it allows for air to get in and out of their lungs. And typically a person would get that for 10 days or until they leave the hospital, whichever one comes first. If for some reason a person cannot get that medication, like the steroid, then instead we can give a drug called baricitinib, and that one takes about 14 days to give. And then another medication that we also have been giving in the hospital is another drug called tocilizumab, and that it depends on like what the person's blood work shows when they come to the hospital. Other treatments that have been talked about, just to touch on them briefly, is convalescent plasma. That's basically like when a hospital takes donated blood from a COVID survivor and then takes the antibodies from that blood and transfuses it into like a person who's currently infected with COVID. Vitamin D is another medication that's been talked about a lot. That's the same over-the-counter vitamin D your doctor may have told you need to take. Ivermectin, which is a drug that's used to treat parasites. That was talked about in the early days of the pandemic, but unfortunately, or rather it has fallen out of favor due to lack of good data. In fact, Merck, which is the company that manufactures ivermectin, and the FDA have also issued statements saying, please do not use ivermectin for COVID. And then also hydroxychloroquine in combination with azithromycin. That was a drug that was talked about quite a lot in the early days of the pandemic, rather around this time last year, and was being given out a lot. We don't give that drug out anymore due to lack of effectiveness. We prefer to give the drugs that I listed at the top there, remdesivir, dexamethasone, baricitinib, and tocilizumab. But otherwise, the only other thing I would have to say is please don't drink bleach. It doesn't protect you against COVID. The side effects and the toxicity of drinking bleach is very, very dangerous, as anyone will tell you. Please don't drink it. That being said, obviously another question I've been asked a lot over the last few weeks, the months actually, is when will this whole thing end? Unfortunately, there's no clear timeline for when this pandemic is going to end. Sorry, we just don't know quite yet. There are a lot of things that need to happen. One of them, first rather, is achieving herd immunity. We need to get people vaccinated, and in terms of how many people need to get vaccinated isn't quite clear at this time either. Vaccines, we also need vaccines that provide effective protection against all of the COVID-19 strains, including the variants that we talked about. We also need effective, easy to administer treatments. All those medications I just touched on that are effective have to be given intravenously. That is, you need to have like an IV line stuck into your vein, and then the medication goes in through an infusion. Steroids can be given as a pill, but that's the only thing, and sometimes we even wind up giving that IV also. There is a drug that's in development called molnupiravir. I apologize if I'm butchering the name of that drug, but that has been talked about in the news, and it is being researched as a possible pill to treat COVID, but that's still in the very early stages of development and may not get approval until the end of this year. And then, of course, until then, we also need acceptance of vaccinating, mask wearing, social distancing, and hand washing, all of which have unfortunately been either highly politicized or something that people have just started to become a little bit too lax and not been practicing in the last few weeks to months. And then also in terms of what else can you do to help end the pandemic. So when the vaccine becomes available to you and your doctor says it is okay to get it, please get the COVID vaccine. Encourage others to get vaccinated if it is safe for them to do so. Promote and encourage, respectfully of course, mask wearing, hand washing, and social distancing. And then of course, if you feel like you're sick, or if you have signs or symptoms, the ones we talked about today, please quarantine immediately, call a doctor, follow their instructions, and follow the instructions of your local public health department. And I just wanted to say thank you for your time today, and if there's any questions, I'm happy to take them.
Great, thank you. I have a two-part question. What should I get tested if I'm displaying only a few symptoms, such as headache, fatigue, and cough, but without a fever? And if so, should my family get tested?
So the answer is yes. As we've seen here, not everybody gets the same symptoms for COVID. It could present in different ways. So if you feel like if you feel like you are sick, make sure you do reach out to your doctor and and discuss with them whether or not you need to get a COVID-19 test. And in terms of, let's say if you live with other people, unfortunately, people who do not have symptoms could also be infected and spread the virus that way. So we recommend that those people in that particular scenario would get tested also.
Thank you. When should children under the age of 16 get vaccinated if schools are reopening?
So right now, the Pfizer, none of the COVID vaccines, I should say, have been approved or authorized for use in kids. That being said, both Pfizer and Moderna, and I believe Johnson & Johnson also, have been conducting trials on the efficacy and safetiness of the different COVID vaccines in children. So in terms of when the COVID vaccines will become available to children isn't quite clear yet, but there are trials that are ongoing right now.
If Pfizer and Moderna were not tested in areas with the South African variant, how well do we know its efficacy?
So, Pfizer and Moderna, their scientists have been looking at and studying the different variants, including the UK variant and the South African variant, to see if they are protective. And they do provide some semblance of protection against the different variants that are out there. So even though they weren't tested at a time in a controlled setting, and these variants were known to occur, they are being looked at, and they do provide some measure of protection still. That being said, obviously, as we touched on earlier today, there is the chance that you might wind up needing to get another COVID vaccine or a different booster shot in the future.
Okay. How long does the vaccine last once I am fully vaccinated?
So that part of it isn't quite clear either, unfortunately. Remember, this disease didn't exist 2 years ago. The vaccines themselves weren't developed and weren't on clinical trials until last summer. So we know that the vaccines do provide some measure of effectiveness and provide a great deal of effective protection right now against the different strains of coronavirus. But honestly, we're going to have to keep an eye on how people do and how well the vaccine works over time.
Is it typical to have delayed side effects? I received my second Moderna's vaccine 2 weeks ago, and I am experiencing soreness and a rash at the injection site.
Right. So in terms of the different vaccine trials, when Pfizer and Moderna published their data, they didn't mention this specifically, but as the vaccine has been rolled out to the larger population, these have been seen in these have been known to occur. So if you feel like it could be related to the vaccine, there's a decent chance that it is. But the shorter answer would be just to make sure, if it's not going away, make sure you talk to your doctor also to see if there's anything else that could be driving these different side effects 2 weeks out.
If I miss the window to get the second vaccine, do I have to start the process again?
No. So once you get the second vaccine, ideally it should be timed within that 3 to 4 week window, depending on which vaccine you get. That being said, if you miss the vaccine because, let's say, the pharmacy didn't have it, or because life gets in the way, just make sure that you do get the vaccine as soon as possible if you miss your window.
Okay, and our last question. I got COVID-19 9 days after my first vaccine. I am taking Bromphin. When should I get my second dose?
Okay, so in terms of people who do get, it is still possible to get COVID after the first vaccine. Remember, the vaccines aren't 100% effective. Unfortunately, they're not magic bullets. And in terms of speaking in general terms, it depends on which treatment you get. If you do get medication specifically for COVID, if it's like one of those monoclonal antibodies that we had talked about earlier on, then you need to wait a full 90 days to let your body recover and for those antibodies to clear out of your system. If you're not sure what the type of drug you're getting, it's best to talk to your doctor just to clarify if you do have to wait the full 90 days. If you didn't get treatment like that, then it becomes a more individualized decision, and that's something that you should also talk to your doctor about if you could get the second dose of the vaccine sooner than the 90 days.
This concludes our program. Thank you, Dr. Catalya, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on our Facebook and YouTube page. Thank you.